I want to answer the question, how do you figure out your cup size after a breast reduction? How do you know what you're going to be before you have the surgery? Number one, you need to make sure you're clear as to whether or not the surgery is going through insurance. If it's going through insurance, you have a little bit less control as the patient regarding how small you're going to be, because your surgeon is trying to do what they can to make sure they take off enough tissue that your insurance doesn't reject the claim. Now, if you're going outside of insurance and you're having a breast reduction, you have a lot more control over your final size. And that should be a conversation with your surgeon. You should, number one, express your goals. And when I have this conversation with people, it's, how small do you want to be? What are you envisioning? And I find people kind of fit into one of two groups. So on the one hand, there are women who say, I want to be as small as possible. Dr. Tannan, I want to be able to go braless. They have been in my way. I am not a fan. I've never wanted to be this big. I want to enjoy what it's like to be smaller chested. So there's that group. There's this whole other group that says, I still want to have fullness. Like, yes, I have large breasts and that's been a part of my identity, but I don't necessarily want them this big. I would still like to be a C or a D. I maybe just don't want to have to wear custom bras or 3 bras to go running. And so you have to figure out where you fit in that. And I will very confidently tell you that you can't come in here saying, I want to be a C, I want to be full, but I also want to go braless, because you can't have it both ways. You have to pick. And don't be embarrassed to speak up for yourself, like advocate for yourself. It's okay to say, yes, I have big breasts and I still want to have some big breasts. I just maybe don't want them this big. So be your own advocate, communicate about your goals with your plastic surgeon, and then they can tell you if that's reasonable, if that's something that they don't think they can do safely, or they can. I strongly recommend this be an open conversation with you and your surgeon.